Wheezing is nothing but the whistling sound produced in the chest due to a narrow airway. It is almost like breathing through a straw. Typically, wheezing may not be heard by the naked ear and is diagnosed by the doctor during a chest examination. However, it is nothing to be afraid of. Let us now understand why your child is wheezing. The lungs are made up of air tubes which carry the outside air into the lungs, where the oxygen reaches the bloodstream. These airways are like a tree, big and broad at the front with numerous small and narrow branches. The airways in all children are very sensitive to different irritants and triggers and react easily when exposed to triggers. However, in children who have extra sensitive airways, the airways react by closing up and becoming even more narrow. This is referred to as bronchoconstriction in medical terms. When the air passes these narrow airways, then it produces a whistling sound, which we call as wheezing. So wheezing is nothing but the whistling sound heard in the chest due to the air passing through a narrow tube to reach the lungs.